U Health Chat. My name is Dr. Henry Dungu and I'm your host for tonight. In the programs that will be airing on Thursdays 9 p.m., we shall be focusing on prevention of diseases for better lives. However, today we are going to talk about procurement and distribution of drugs by the national medical stores. And with me in studio, I have Mr. Dan Kimosho, who is the Principal Public Relations Officer of National Medical Stores. Mr. Kimosho, welcome to the show.
Thank you very much, Doctor, and good evening, viewers.
We are so glad to have you tonight on this show. And for you viewers, we'll be having these discussions really focusing on how to prevent diseases. So one might wonder, do medicines prevent diseases? But actually, they will tell us that indeed medicines can help us prevent diseases, some of them. As we start this discussion, kindly tell our viewers a brief background of the National Medical Stores.
Oh, thank you once again, Doctor. National Medical Stores is a government corporation. It was established by the Act of Parliament in 1993. And these National Medical Stores, when they were coming up with the Act, or when they were putting the Act in place, the Act had three roles for NMS, for National Medical Stores. Our mandate is a threefold mandate. And one is to procure, two is to warehouse, three is to distribute medicines and medical supplies to all government health facilities in Uganda. So, actually, in a nutshell, that is the mandate of National Medical Stores, and I think we've been in place for the last now, we're in the 26th year.
So you talk about medicines
and medical
supplies. What's the difference?
Medicines, of course, these are, you would say, the drugs. And the medical supplies are the items and the other items that are used to administer drugs. If you say cotton, if you say plaster, if you say syringes, if you say many other items that are used in the administering of the drugs or the medicines, actually.
How about medical equipment? Is that also
no, medical equipment isn't within our mandate. Actually, medical equipment is left to Ministry of Health or individual facilities. They budget for it, they get the money, they procure by themselves. Or Ministry of Health quantifies the need for those that are cross-cutting and finds a way of procuring. Ours is typically getting of, for example, if I can graphically put it, every financial year, like now we are starting a financial year. Now, we get, like any other institution, we get money from Ministry of Finance, of course appropriated by Parliament. So when we get this money, because they first give us figures that for this financial year, you're likely to get this amount of money. So when we get that money, we communicate back to health centers, facilities. And when I say facilities in our context, it is from Mulago, the national referral, to my health center too.
That's the one in the village? At
the parish level. For example, in my context, it is called the Remukoma Health Center 2.
Remukoma Health Center 2.
Actually, for the rest, we have Health Center 3. But at parish level, it is a Health Center 2 are supposed to be at parish level. So, we also notify them that government has indicated that we shall get this money, the indicative figures. And we tell them, now, if this budget is availed, your portion will be this. So we also give them indicative figures, how much they are likely to get in the next financial year. Because that happens before the financial ends. So, and then we give them a notice that now that you have these figures, kindly come up with a procurement plan.
Okay. How do you want to buy this medicine?
What do you want in this money? What should we buy for you? And then what do we expect? What we expect is that the health center will sit, look at its needs in terms of the number of patients they've been receiving and what they've been suffering from. And then that informs them of what they will need in terms of medical supplies. But then what is very clear, or what should be very clear to our viewers, is that what the facility needs must suit or fit within the available budget.
So you mean each of these government facilities or these facilities has a budget allocation?
It has a budget allocation.
But the funding is at the Ministry of Finance?
Yes.
Then it goes to National
Medical Stores. It's appropriated by Parliament. Finance sends the money. Then we get to NMS. We get these procurement plans. Actually, by the time they send us the money, we have already got the procurement plans. So now, when the money comes, we embark on the buying process or the procurement process, acquisition from suppliers. Now, first of all, when we get a procurement plan, we aggregate it from all the facilities. And then we come up with what we call the National Medicines and Medical Supplies Procurement Plan.
So you get the institutional plans, put them together to come up with a national procurement plan
for medicines and medical supplies. And
then
we start buying. And then when we buy, now when we start a financial year, like now it has started, we give what we call a delivery schedule. This is to communicate to the facility that National Medical Stores would be expecting, because you see, after they have made the procurement plan, we expect them to make cycle orders. Now, what do I mean by cycle orders? We go to the facilities every after 2 months. That means in a year, we go there 6 times.
To each facility?
Each facility. Save for Molago and the specialized institutes. Certainly, Cancer Institute is out of those because now they buy their own medicine. So they buy their own medicine and administer it at source. Now, when I talk of specialized, in this case, I mean Heart Institute, I mean Butabika, I mean, for example, blood.
The blood bank.
Blood bank. And Mulago. For those, we go monthly. Then for the rest of the facilities, we go every after 2 months.
Every after 2 months.
Meaning that we go 6 times a year. And then in that delivering schedule, we indicate that on this, not beyond this date, we expect a cycle order from the facility. And not beyond this date, NMS should have delivered. So when you go beyond your date of ordering, you have disappointed us. And certainly disappointed the population, because then they will not get.
So it's not NMS to say that now we have medicines for Unit B, let's take the medicine or the supplies. It is the unit to make a request to.
It is standard that we must have your medicine because we have your money.
Yes.
Now,
but it has to be an initiative from them to request for medicines. Is that right?
Yes. And we indicate it early in time that don't go beyond this date before you give us your request. And before this date reaches, or not, as in our delivery, expect us not beyond, for example, 15th of August, will have delivered. So when you delay your cycle order, you are certainly affecting our delivery time. So what we normally appeal to the public and to the facilities is that let's all keep it within time. If your ordering time is 15th, the deadline, of August, for example, would request that you will have given us your order. And if our delivery deadline is 20th, we also expect, and you should also expect as a facility, that NMS should not go beyond that specified date before we deliver.
Now, for those of you who have just joined in, this is UBC TV, and the program is U Health Chat. I'm Dr. Dungu, and my guest tonight is Dan Kimosho from the National Medical Stores. We tend to hear people ask, do you deliver medicines and supplies only to government institutions, or you do even to private institutions?
You see, at the inception, we are delivering to government has facilities. Now, later, the mandate has kept on expanding. Later, then government told us we should deliver medicines to all the facilities, the facilities within the forces, I mean the barracks. For example, UPDF, police, and prisons. We also deliver to their facilities.
Before that, you are not doing that?
I think 5 years or 6 years, 5 years back, we are not doing that. But the mandate expanded. Then later, we never used to do a lot of vaccines because it was under UNEP.
Okay.
Then the mandate further expanded to storage and delivery
of
vaccines. And this we have done, I think, for 3 years or 4.
Okay.
And certainly there is a clear trend of improvement. I would, without missing my words, that since we started this delivery of vaccines, we have moved as a country from 53% coverage to 90, I think 8 or 99% coverage.
From 60 to 90%?
50 something to 90 coverage.
That's a good achievement.
Very good, to the extent that for the last 2 consecutive years, UNICEF and Gavi awarded Uganda a prize for being the best in East, Central, and Southern Africa in cold chain management.
So from the time when NMS took on this mandate, your performance was even recognized?
I mean, at least for the 2 years consecutively. Last year and the previous year. You know, they do assessments every year in East, Central, and Southern Africa. And as we talk, we are the benchmarking place
for other countries.
For other countries, East and Central, Southern Africa, in terms of cold chain management. And this is the whole process of vaccine management in terms of storage, transportation, distribution. And as we talk, Uganda is the benchmarking country. I don't know what will come out this year, and maybe...
We'd say congratulations.
Yeah, thank you very much. And I mean, that's how our mandate has been changing.
You know, you talked about cold chain. Maybe some of our viewers might not really understand what cold chain is. Can you throw a bit of light into that?
Oh, you know, to make it maybe a little simpler, is that vaccines have to be kept in a more sophisticated way than the rest of the medicines. Okay. For example, you need to keep them under certain temperatures.
Okay.
And most of the times, you must keep it in a cold environment. Not above some temperatures and not below some temperatures.
Okay.
And this applies at the storage, it applies at transportation, it applies at the point of delivery where the administration of this vaccine is going to happen, at the facility level.
Okay.
So when you're talking about cold chain, it's not a one step. You're talking about the whole process. Someone examines you from the point of entry when you receive them to the point of when they are administered.
to the person,
and that to the beneficiary.
okay.
So, and that's what informs them of how best you have been to the line or kept to the standards as expected by maybe WHO or any other institutions.
Mr. Kimosho, people sometimes wonder, I know you've talked about the delivery frequencies, but if you don't mind, I wanted you to throw more light on this. The frequency of delivery of these medicines and medical supplies. I know you mentioned about it, but maybe you can throw more light so that people understand. There are many times when people go to institutions, hospitals, and they're told there are no medicines.
Now, like I earlier on mentioned, we are expected to deliver medicines and medical supplies to facilities every after 2 months.
Every after 2 months, yeah.
Save for Molago, National Referral Hospital, Butabika,
Heart Institute.
Heart Institute, and blood transfusion. Now, for the rest of the facilities, I mean, if I may be specific, regional referrals to health center tools, we go there every after 2 months.
Okay.
So if you break down there, we go to those facilities six times a year. Now, there is something that I would want to bring forward because it's normally asked. You would hear people say that for health center 2s and 3s, do not make their orders. That we sit in Entebbe and maybe dream of what they may need and then take what our dream tells us, which people normally call push. That we just sit at the center and push whatever comes across our mind. And we are very categorical about that. This the level of care at health center 2s and 3s, they used to make orders like any other facility. But later, we realized that there were competence gaps. You know, someone is trained as a nurse. They are not logistical. They do not have that background of
trained in how to
quantification and the rest of the areas. So you realize when they make an order, you find very serious gaps. And it takes a lot of time. To the extent that you would even find it very hard to beat the deadlines as stipulated in our delivery notes, schedules. So our mother ministry, Ministry of Finance, of Health,
Ministry of Health, yeah,
came up with an idea which is called the best kit. Now, the best kit, in the best understanding of anyone, is that every beginning of a financial year, national medical stores, ourselves, we liaise with district authorities. That is to say, the office of the district health officer and the in charges of individual health facilities. And we put together kind of a meeting, a conference of some sort, and we send people from the center, from national medical stores. They are joined by the people from the district and the in charges of individual health facilities of specific districts. And now they sit down and come up with what they need.
Okay.
At that time, they come with their patient books and the rest of the information. They sit down with our people from the center and the DHO's office. Now, they tease out what they need for the next financial year. Now, when they do that, they really have come up with a procurement plan of what they think we should buy for them
in the next financial
year. And they sign against it, put their name and the telephone number. Now, when that happens, the only difference is that they do not send us requests every after 2 months. No. We get what they have ordered and divide it by 6.
Okay.
Meaning that for every time we go back, we are taking equal proportions of their request.
What they planned for,
If they
when you
said,
advise them on how to plan.
yes, if they say, for example, that they will need 12 tins of amoxicillin or Panadol or any other product, we divide that quantity by 6. Now, every time we go to deliver at the other facilities, we also deliver to them.
Whether they ordered or not.
They don't order actually.
Okay.
They give us a standing order at the beginning of the financial year.
That makes sense, yes.
And we, you see, it has a lot of issues. First of all, most of these facilities are in deep remote areas. It takes a nurse a whole day to transport an order from the facility to the DHO's office. As if that is not bad enough. Some facilities have like 2 health workers. Or
if one goes to pick the medicine,
yes,
the others are not there.
then patients won't get attended to. Or some have even one, that when they go to deliver the order, the facility will be closed. So our mother ministry, out of innovation, thought we can bridge that gap, and we agreed with them, and we introduced what we call basic kit. So when they give us their standing order for the annual or the year, we divide it by 6. So every time we take for referrals and the rest, we also take for them.
Okay.
Now, we used to take this up to district and would leave it to the district to transport it to health centers.
But now you do it yourself.
Now, still together with our mother ministry, we introduced another initiative called the Last Mile Delivery.
The
Last Mile
Delivery.
When we deliver the district, we again hire the last mile providers. These last mile providers pick these medicines from the district to individual health facilities.
I think what we'll do now, we'll take a short break with a video of the distribution, because he's been describing up to the last mile. Now we want to see how this is in a video. After that, we'll come back.
TV is the only public broadcaster of choice.
We inform, educate, guide, and entertain.
We bring you news as it is, wherever it is happening in real time.
We take you faraway places from border to border.
We keep you up to date wherever you are.
In the languages of Kiswahili, Luganda,
and English.
UBC TV, inspiring Uganda.
We are privileged to have received the drugs from NMS as a donation to enable us carry out the therapeutic activities in a Acholi sub-region. They have actually given us an assortment of drugs, mama kits, and some sandwiches worth 80 million shillings. This is a very big boost to the activities that we are going to conduct. Most times the turn up of the people when we go to the areas when we are doing the Army Week is so big. This time I want to assure you, with the boost that we have got from NMS, we shall be able to satisfy many of our clients who turn up. Okay. We have got also the donation of over 100,000 mosquito nets from the Ministry of Health, which we are also going to distribute during the Taresi Camp. All the districts in Acholi region will benefit from the medical activities that we are going to conduct. That is Kitgum, Gago, Pade, and Lamu in Greater Kitgum. And then in the Gulu side, we shall have Gulu itself, Lamu, and then Amuru, and then Noya and Omoro. The advanced team of the surgical male circumcision is already on ground, and the turn-up is big. And we are happy when people are seeking for care. That shows that people these days really value health, and which is very, very, very instrumental in socio-economic transformation. You need a healthy population for development.
Welcome back. This is You Health Chat. I'm Dr. Dungu, and with me is Mr. Dan Kimosho, Principal Public Relations Officer, National Medical Stores. We are discussing distribution of medicines and medical supplies as done by the National Medical Stores. And before we went for break, we're talking about how the National Medical Stores does a last mile delivery, reaching up to the person in the community where others would take long to reach. But how do you do that? Don't you find challenges in delivering that?
Yeah, we certainly find challenges, but for us challenges are just an energizer. It's like taking a Red Bull when you're getting a little tired. Because whatever challenges that comes our way, we innovate around that, and we find a way of maneuvering for better service delivery. Because what happens is that we actually hire roughly 2 service providers to serve the whole country, but then we divide them, for example, in 2 regions. And then we give them, we have our memorandum of understanding and the contracts and the rest. And we indicate to them what we need. They are deliverables. And the major deliverable is that they must pick this medicine from the district stores and distribute it across the district within a maximum of 14 days from the time when NMS has delivered to the district headquarters. Now, and for us to be sure that you have done this work, the in-charge should sign and stamp for you. And we have all the scanned signatures of the in-charges for health center 2s and health center 3s.
So no one can forge.
No one can forge.
The signature is for so and so.
At least they cannot attempt. They know how strict we are with some of those things. So they cannot attempt. That one I'm very sure. Because we have done it now, I think it's been on for over 7 years, last mile. And every time we are improving. So, and it has helped. You see, originally, you deliver medicines to the district, and they are kept at the district for over a month. Or you reach the next cycle before the facility receives what was delivered in the previous cycle. And then it would beat the logic of the whole distribution process. So this time we make sure when we deliver 14 days after our delivery at the district, all the facilities have received their medicine. And we work closely with the DHOs to supervise. Because some of these service providers don't even know the places. So they must have someone from the DHO's office. They must be supervised when they're picking the medicines. So we are so strict to ensure that we do not have preferage in the process. And there are standards how the service provider must transport these medicines. They must be fully covered. And we have had several engagements with police across the country.
With police?
The DPCs,
okay,
and the CIDs, and the DISOs, District Internal Security Officers, and the RDCs. We have had several engagements to try.
Actually, now when you bring in the idea of how those other stakeholders come in, a question comes to me to say, how do these policymakers, you know, the politicians get to know that NMS has delivered? You know, many times they want to take that as a situation to get ideas from, if I may use that.
Simple language. Anyway, what happens with us is that deliberately we've been engaging our stakeholders, and security organs are part of that. So we sensitize them how a government medicine looks, how does it look like, how do you arrest them, how do you follow them up, because we really give them their leads and how to follow these guys up. And we are there for them if they need us as witnesses, because we have the batch numbers in our system. We know we supply this batch number in this region, and for not bulk items, we may even be specific to the batch may be specific to the facility. So we cooperate and work with them. But back to your question, we also introduced what we call the Smart Care. It's an application.
Smart Care
app.
Okay.
Part of it is to get to our stakeholders as fast as possible. So when we dispatch medicines for Moroto, every member of parliament in this country gets a message that delivery is done in Moroto for essential medicines.
Wow, that's interesting.
Because we put them on the database. Every RDC,
they get to understand,
they get to know
medicines have been delivered.
Medicines have been delivered. Now we're enrolling the cows in our system. So there is no, we do not have, we have tried as much as possible to eliminate the gray areas so that whoever wants this information can access it. If they want to follow up, they can follow up with us. Because
there's nothing like I'm an area MP and I have no idea.
Actually, the challenge is, you see, we have not distilled to say that you get for your specific constituency. They get, and of course, to me, the logic is that a member of parliament represents the whole of Uganda. So most of them have been complaining, some of them have been complaining.
Too many
it's too much of information for them, but certainly we still believe.
Can I opt out?
Yes, if you communicate and say, please put me off, we shall put you off, because it's not mandatory. And but it's to your benefit and to the benefit of your people, that if someone complains that they have not received medicine, as a member of parliament, as an RDC, as a chairman LOC5, you really want to say, but I received this message from NMS, what did they mean? Was it a hoax? Then it eases your process or the procedure of following up with us or any other person who is responsible, even at the district level. Because then you are in touch with what happens on the ground.
Now, we have all this information, the smart applications, telling people that we have the medicines. Tell me about the drug stockouts. You know, we constantly get this information that there are no medicines, there are medicines that are brought in and they are expired, they are thrown out. What do you have to say?
Stockouts is a mystery. True.
There are stockouts, then you hear medicines have to be destroyed.
Yeah, true, stockouts happen. But how do they happen? One is that the population is increasing every day. And as a country, for some reason, we have neglected prevention. We're not looking at prevention.
We want to treat.
You see, stockouts can be managed in strictly two ways. You reduce the consumption or increase the supply. Now, how do you reduce the consumption? You reduce the consumption by having a healthy nation. People are not falling sick. Then you reduce stockouts because the little that will be available will be enough. Or you increase the supply. Now, unfortunately for us as a country, the supply, the budgets have not been increasing as much. Yet illnesses, as you may be aware, have been shooting up every day. And suffering from the very basic typhoid, cholera, dysentery, malaria, and even HIV.
All preventable.
All preventable. Even HIV has gone again high. Now, unfortunately for us, when we are still struggling with preventable, the non-communicable are also on the rise in equal measures. The diabetes, the pressure, the cancers. It's as if they're in a race with someone. They're increasing in our population. So the money that would be concentrating as a nation to treat very serious diseases like cancers, the diabetes, the hypertension, and the rest. But still, some of those we can do something around them. But okay, they are more serious. So the money would be concentrating on those. Well, it is still being shared by diarrhea, dysentery, typhoid, cholera, malaria, cough, and the rest. Now, for us, actually now you bring me to a very critical area. We have decided as an institution that together with our mother ministry, the Ministry of Health, I don't know why I like finance. I think one of these, money. I'll be a serious businessman. Why I like finance. Anyway, Ministry of Health, we have agreed to embark on the gospel according to Saint Prevention, to tell Ugandans to prevent diseases. It is in this country, Doctor, where people claim rights and they don't think they have any responsibility. The government distributed mosquito nets across the country. People still don't want to sleep in mosquito nets. They will tell you it brings me heat, it's hot at night.
Hot,
Now, feeling hot at night and suffering from malaria, what is more costly? Now, it is his right not to sleep in a mosquito net. When they get malaria, it is the government responsibility.
It is.
For them it ends, for us anyway, myself inclusive and other Ugandans, for us it ends with the right. But for us, and we still tell people that someone who is not responsible should not claim a right.
You know, the right to health is a broad thing.
Yes.
But to narrow it down, the right to health does not mean the right to being healthy. The right to health carries certain responsibilities, as you've rightly said it.
Yes.
But many of us do it the other way around.
Opposite.
It's my right to get treatment.
Yeah, you see, the government has told people, this country is one of the few countries where people get free HIV treatment. They still tell them, be faithful. Or at worst, be faithful, abstain, be faithful, or use a condom. A Ugandan will tell you, in Africa we don't eat sweets in Kavera. It is their right to unfold their sweets and eat them not in Kavera. When they catch HIV, it is the government responsibility to treat them.
And they didn't want to take on the preventive strategy.
They don't want to listen to anyone when it is before. You look at borders, you may know how many borders accidents are in Mulago, in the neuro department.
Yes.
You know, you have more than, I think, 30 on a daily coming in.
Head injuries.
Head injuries. You tell people put on helmets. Now, for some reason, they will say, you force us helmets, we shall not vote properly. You leave them to ride without helmets, they all go to Mulago. It is their right not to put on helmet. It is someone's responsibility to treat them.
And they will complain.
And people will complain. And bitterly at that. You find a bus in very poor mechanical conditions on the road going to Bukoma Nsimbi or Chana Mukaka or where. Now, when it reaches in Ruera, it turns around. 30 people are injured. They rush them to Masaka. They forget the driver who was driving a poor mechanical conditioned car. They forget the policeman who had to get Kint Kidogo to let
allow the vehicle move on.
They forget the owner who did not take the initiative to work on the vehicle, or let alone insure it. What people remember is that this government has not given us medicine. Now, what they forget is that when these facilities, for example, Masaka was planning, they put in a small allowance of emergencies. They couldn't imagine how many officers were going to be corrupt and leave bad mechanical conditioned vehicles to be on the road. They did not really count, and they couldn't be sure of how many Ugandans were going to drive while drunk and crash.
And then they're brought into
abruptly. So you find a budget that is supposed to be consumed in a month is consumed in 2 weeks, typically out of reckless living.
But now NMS, whose mandate is to procure,
warehouse,
and
distribute,
and is now going to prevention. Are you not going away from your mandate?
No. You see, if Ugandans can be healthy and we stop distribution, then for us we would thank God for that. We are not trying to distribute to the at the expense of Ugandans dying. No, we want to distribute, yes, but can we distribute and take care of Ugandans who have done everything right? Then, because of some reason, the man will get ill here and there. But when they have done everything right, but we do not want really to condone this practice of doing everything wrong, and then they expect the government to rectify it. Actually, that has been a weak point, because people do everything wrong. The demand is overwhelming. You cannot meet the demand, and everyone from north to east, south to west are baptizing you with fire as to how much you have failed to deliver medicine, not knowing that you have delivered to the maximum of the available resources, to the extent of the available resources, but you cannot distribute to the extent of reckless living, because that is unpredictable. Unless you're a witch doctor and you want, maybe you can be a foreseer or a witch doctor to determine that such a number of people will get drunk, crash their cars, and then we come in. But if you're doing scientific things, you will only look at your books, no malaria, we had these cases, do typhoid this, and do average and come up with a scientific number or demand at that for a specific medicine or medical supply.
We need to really emphasize this preventive strategy.
And for me, doctor, I think this is what we miss as a country.
Maybe you should start distributing helmets.
But we have distributed mosquito nets, and recently now malaria had disappeared. Everyone was telling us reduce on Coatam. Apparently everyone is telling us in the north
increase
malaria, it is on rapid increase. And I can tell you, before you know, they will tell us it's an epidemic. Now, why? You find out the basic things that we need to do. You know, doctor, in this era, we are still suffering from typhoid. I be moving down in my area, and you know, someone You're a doctor, you can put it right. What causes typhoid?
Eating dirty.
No, not eating dirty. You tell them. Because, people must understand what they eat.
When you eat dirty, you get typhoid.
Fecal matter,
I didn't want to use that word.
You see, we must stop cosmeticking.
Okay. When you eat fecal matter, you can get typhoid.
Typhoid. And now you go and tell your wife that I'm suffering. When you are telling your wife that I'm suffering from typhoid, what are you literally telling them?
We are coming to the end of this program, Dan. Tell me your last message to the viewers.
And this is not my message. This is NMS message.
NMS mandate.
And the Ministry of Health message. That if you can forget about anything else in this country, please, let's go to the basics of prevention. Let's wash our hands. Doctor, you go on a party, they tell people, wash your hands. Someone washes this finger and this finger and this one. And they just do like this and they eat. Just awakening germs. Before you drive 2 kilometers, they are holding the stomach. And they are crying how this government has not provided medicine. So for me, if we can forget anything about this show, let's remember about prevention.
Well, thank you very much,
Thank you very much, Doctor.
Thank you so much. To you viewers, this has been UBC TV, and the program is You Health Chat. I'm Dr. Henry Dungu, and until next Thursday, keep watching UBC.
Was brought to you by
You Health Chat is brought to you by National Medical Stores, who are mandated to procure, store, distribute essential medicines and medical supplies to all public health facilities in the country.